Alright, so this video is going to look at the SFMA top tier test. So there's 7 tests that we're going to go through to look at and diagnose movement dysfunction in the presence of pain. So what we're going to start with, with a cervical dysfunction type test. So the first thing we're going to look at is cervical flexion. Alright, so for all of these tests in standing, we're going to have our feet straight ahead. Under our hips, we're going to have a nice tall posture. And the cervical flexion, you're going to bring your chin down to your chest. A functional normal pattern will be that person can bring their chin and touch their chest with it. Anything less than that is going to be dysfunctional. The next cervical pattern we'll look at is cervical extension. With cervical extension, we're having the same upright posture, arms down by your side, and then you're going to have your client look up towards the ceiling. So just looking straight up. With the mouth closed, so you may have them clench their teeth together and look straight up towards the ceiling. To be functional normal, that person should be able to get within 10 degrees of looking at the ceiling, or their face being parallel to the ceiling. The next test we'll look at for the cervical spine is going to be a combination of cervical lateral bending and rotation. So first you're going to have your client rotate all the way to one side, as far as they can go, and then you're going to have them bring their chin down and try to touch their clavicle. Functional normal will be if the person can bring their chin to their clavicle past mid-clavicular region. Alright, so that's a cervical test. Moving on down, we're going to go to the upper extremity patterns. There's 2 upper extremity patterns, and they're going to look at combined motions. So the upper extremity pattern 1 is going to look at a combination of internal rotation, extension, and then adduction of the shoulder. So you're going to internally rotate your arm, bring it behind your back, and try to touch the inferior angle of your scapula. If you touch the inferior angle of your scapula, it's functional normal. Anything less is dysfunctional normal. You can measure the distance if you want with a measuring tape. Upper extremity pattern 2 is going to be a combination of abduction, external rotation, and shoulder flexion. You're going to reach behind your back to touch the opposite spine of the scapula. So left arm to the right spine of the scapula. In the upper extremity region, there's also 2 provocation tests. The first one is going to be an impingement sign, just like the one in the FMS. You're going to bring your hand right across to your opposite shoulder, lift up your elbow as high as you can, and you're asking if the person has pain. The second provocation test is going to be the horizontal adduction test, in which you're going to bring your arm across your body, horizontally adduct it, give it a little stretch, and you're asking the person if they have pain. Generally, that person would have pain at the AC joint with that test. Moving down even further, we're going to look at 3 multi-segmental tests. Multi-segmental flexion, extension, and rotation. Multi-segmental flexion is going to be simply a toe touch. So you're looking at the hips, you're looking at the lumbar spine, you're looking at the thoracic spine. Where does their motion come from, and can they touch their toes? So you might want to look at that from the sagittal plane, feet still under your hips, the person's bending over with locked knees, trying to touch their toes, and then back up. Most of that motion should come from their hips. They should initiate that motion from their hips with a posterior weight shift. The second multi-segmental motion will be multi-segmental extension. For that, you will have the person bring their arms overhead. Again, you'll look at it from the sagittal plane, and you're going to have them reach back as far as they can. Functional normal will be if the scapula move behind the heels and if the hips move past the toes. So in this motion, my scapula should move past my heels, and then my hips should move forward past my toes in opposite of that. The last multi-segmental motion we'll look at is multi-segmental rotation. For that, the person is going to relax their arms by their side. If they're turning to the left, they're going to turn through their hips, knees, shoulders, as far back as they can and through their head. And try to look back behind them. And then same thing to the opposite side. So you may want to look from behind here and looking back. Functional normal will be if the person has a combination of about 100 degrees of motion, about 50 from the upper extremity and trunk, about 50 from the hips, lower extremity. So their trunk should be past 90 degrees here. Shoulders should be about facing